There are multiple facets to an HS treatment plan, and I like to think of it as starting at the top and working our way into the skin. The role of topical antibiotics can play a role in terms of reducing inflammation there. Topical anti-inflammatories can also help in reducing the discomfort or pain associated with the surface of the skin. The thought being that if we can reduce some of the swelling and inflammation on the surface or any sort of bacterial element that might be involved, maybe we can reduce the tendency towards some drainage and pain associated with the surface. They don't tend to get deep enough to necessarily stop the development of new nodules, but at the very least the surface can feel a little bit more comfortable. To manage HS, we often do have to consider systemic medications, which would be medications that we take by mouth or injectables. These are medications that are designed to focus on the actual causes or different aspects of HS overall. Most of the time, these have been ongoing or recurrent bouts of antibiotics, for example, suppressive courses of antibiotics. I often find they work more as an anti-inflammatory than a true antibiotic because, again, we don't really have a true singular source of bacteria causing this, that they might provide some benefit, some control of disease symptoms, but not necessarily stop it from progressing. We've often even considered using and use at times retinoids systemically, which are medications that are often used for acne, for example, with the same thought in mind that if we can stop those pores from getting clogged or blocked in the first place, that perhaps we can reduce that tendency towards inflammation developing. Knowing that there are so many components to this condition, we may even start to target hormonal pathways. It's not uncommon for us to take a condition like PCOS, also known as polycystic ovarian syndrome, and try to address the hormonal components to it. Doesn't hurt to include that in our therapeutic regimen to control some symptoms along the way. Increasingly, we're seeing that biologics are being used to address HS. I think of them as almost going into your system and looking for cells that have that inflammatory flag on them and pulling them out to reduce that tendency towards inflammation. By doing so, then you will see that swelling, inflammation, and pain gets under better control. If you're really struggling to find the right treatment plan for HS, it's really important to sit back and define what aspects of the condition are bothering you the most. Understanding that there are so many factors with each individual patient that we may need to address really does help tailor these therapeutic regimens for each individual patient.